Okay, this is a review for West Penn Hospital School of Nursing for the pediatric drug dose calculation. So I'm just going to go through these 10 questions and hopefully it helps you as you're preparing for the pediatric drug dose calculation. I've not gone through this before, so if I make mistakes, I'll try and address those, and then you'll let me know in the comments if there's any concerns. All right, so it says a child weighs 22 pounds with a order of 30 milligrams per kilogram per day in divided Q8H. What is the individual dose in milligrams? So what we want to find out is the specific individual dose in milligrams. So what I want to do first is understand what does Q8H mean. That means we're going to get this in 3 doses. So this is the total per day. So I need to divide this by 3. So one of the things that I do as a strategy is if it's in 3 divided doses, instead of worrying about the 30 milligrams, I'm just going to calculate for the 10 milligrams per kilogram per dose, because 1/3 of 30, or 30 divided by 3, is 10. I do need to convert pounds to kilograms, but because I'm not sure entirely how your school or the West Penn school does their rounding rules, I'm just going to write this out using dimensional analysis um, without doing like the just dividing by 2.2. Although if I do that, um, if I just divide by the 2.2, I get 10 kilograms. So 10 kilograms times my 10 milligram per kilogram per dose will give me 100 milligrams per dose. So they would get 300 milligrams per day, 100 milligrams per dose. So that's number one. Number two, child with meningitis is ordered. Available is 150 milligrams per 5 ml. Physician orders 225 milligrams. How many milliliters? Round to the nearest tenth. So this does tell you to round. So this I'm going to do, I'm just going to follow what's called order over available times quantity. This is no different than a traditional adult medication dosage. There's no pediatric tricks to this. Oops, you know what? I started writing the wrong thing. What's my order? That's what I want to start with. Sorry. My order is the 225 milligrams. My available is the 150 milligrams. And my quantity is the 5 ml. So 225 times 5 divided by 150. And then I get an even 7.5 milliliters. So I really don't need to round because there's my answer. I guess I should qualify that. All right. Let's see if 66 divided by 2.2. Good. That gives me an even. So I'm just going to write 30 kilograms. All right, so a child weighing 66 pounds or 30 kilograms is prescribed 30 milligrams per kilogram per day every 6 hours. So that's 4 times per day. The drug is 200 milligrams per 5 ml. How many milliliters do you administer? Rounds to the nearest tenth. Now, this just says to give them 30 milligrams per kilogram per day, and then it says every 4 hours, or I'm sorry, every 6 hours. So again, we're going to do the same thing where I'm going to take that 30, and I'm actually going to divide that dose out to 7.5 milligrams per kilogram per dose. Okay. So all I did was I took the 30 milligrams and I divided it by the 4 because I'm giving that 4 times. So my total in the day is 30. So this doesn't actually tell me how many milliliters to administer per day or per dose. I'm assuming per dose, but I'll calculate both things. I'm just letting you know as I'm going through this. So I'm going to take my 30 kilograms times the 7.5 milligrams per kilogram per dose, and that'll give me 225. milligrams per dose. And then my available is the 200 milligrams and the 5 ml. So per dose, I'd get 5.625. And then I would round that to 5.6 milliliters. That's per dose. If they wanted to know the per day, I would just basically follow the same format, but I would say 30 milligrams per kilogram per day. And we can see we have 30 kilograms is how much the patient weighs. So 30 times 30 would give me 900 milligrams per day. And then again, divided by 200. So I'm showing you both these just because I'm not entirely certain if they're looking for the per dose or the per day. My assumption is they're looking for the per dose, but just in case, I give it to you both ways. So this would be 22.5 ml, and that would be per day. So there could be two answers. I think it's the per dose answer, though. All right. It says a doctor orders amoxicillin, 30 milligrams per kilogram per day, divided every 8 hours. So again, this is 3 times per day. For a child who weighs 48 pounds. So 48 divided by 2.2. So that gives me, it says it's available in 255. How many milliliters do you administer? So again, this isn't being entirely clear about if they want per dose or per day. So I'm going to give both. Okay. So I'm going to do the, this time I'm going to wait to do any rounding until the very end because 48 divided by 2.2 is 21.818181. So just to be on the safe side, especially since this is pediatric dosage, I'm just going to set this up by doing 48 pounds. I'm going to create a long dimensional analysis. So 2.2 for 1 kilogram. And then I will multiply by the 10, right? Because it's 3 divided doses. So this is 10 milligrams per kilogram per dose. And I'm also going to do the same thing for per day because again, it's not giving me clear. I just want to make sure if my assumptions are correct, they're asking you the per dose, but I just want to make sure I'm giving you all the details and all the potential possibilities. So if I take the 48 divided by 2.2 times 10, and then I'm going to get 218.18 repeating. So I'm not going to write it all out, but then I'm going to divide by my available, the 250, times my quantity. So I'm just going to leave what I have in the calculator, the 218.1818 repeating. I'm going to multiply by 5, divide by 250, and I'm going to get 4.36 repeating. So if I get 4.36 repeating and it just keeps going on and on, then I'm going to round that to 4.4 milliliters, and that's per dose. And then if they were actually asking for the per day, I'm going to go back 48 divided by 2.2 times 30. And this is where I get 654 looks like 54 repeating. And again, I'm not going to write these out. I'm just going to put it into I'm just going to leave it in the calculator. And then I'm going to take my 250 because this is my available times my 5. So I'm going to take my 654.54 repeating times 5 divided by 250. And then I'm going to get 13.09 repeating. And I'm going to round that to the nearest tenth. So 13.1 ml per day. Okay. So sometimes you'll notice a discrepancy in the per dose and per day, meaning that if you do your division or multiplication at the end of everything, you might get a different answer. So that's why I always say like maybe account for it based off of the order, not necessarily at the very end, but if your instructors have told you something more specific, I just wanted to show you how I would answer this. Number 5, child weighing 30 pounds. So again, if I divide by 2.2, I'm going to get like a 13.63 repeating. So I want to not just assume that. You might round to the nearest tenth, and that might be okay. But because it's pediatrics, that's why I'm um, kind of using some discretion about my rounding rules. Now, this is written a little bit differently because it says the doctor orders ibuprofen 10 milligrams per kilogram every 6 hours. Okay, so it's telling you this is the per dose. So I don't need to divide anything. Okay, it says the ibuprofen is available as 100 milligrams per 5 ml. How many ml would you administer? So for this one, I'm just going to focus on the per dose. So I'm going to take my 30 pounds, converting pounds to kilograms, and then multiplying by the 10 milligrams per kilogram. I'm going to get 136.36 repeating, and we're in milligrams. And then I'm going to, because all this cancels out. I know sometimes or usually show that. I'm just trying to run through this real quick, but um, and then it said 100 milligrams per 5 ml times 5 divided by 100, and then I get 6.81, and I'm going to round that to 6.8 milliliters. So again, on these other questions, like question 4, where I have per dose and per day, I'm just not sure specifically how they want you to answer that question. That's why I'm giving you the per dose and the per day answer just in case. All right, number 6. We have ampicillin, 50 milligrams per kilogram per day, divided every 6 hours. So that's 4 times. For a 2-day-old who weighs 6 pounds. Oh, little guy. So 6, okay. 6 divided by 2.2 gives me 2.72 repeating. So I'm just going to use discretion and save my rounding to the very end. And it says how many milligrams will you administer every 6 hours. So that is being very specific, and just asking how many milligrams every 6 hours. So they want to know per dose. So if I'm giving 50 milligrams per day, what I need to do is find out how many milligrams to give per dose. So that's per day. And if I'm giving 4 per day, then I need to divide by 4. So 50 divided by 4 gives me 12.5. Okay. So that's where that number is coming from, what I'm writing here, the 12.5 milligrams per kilogram per dose. And then I'm going to do my 6 pounds. I'm just going to write divided by 2.2 pounds per kilogram. And then this will give me my answer in milligrams. So 12.5 times 6 divided by 2.2. I'm going to get 3.409. That's not right. Oh, yeah, I guess that is right. Wait a second. Let's try that again. So 6 divided by 2.2 times 12.5. There we go. I was going to say, didn't seem right. My numbers wrong. I must have hit a key wrong. And I'm going to get an answer of 35.09 repeating. So we're going to round that to the nearest tenth. So I'm going to give them 34.1 milligrams. All right, we have a child weighing 40 pounds. They're ordered lorazepam, 0.05 milligrams per kilogram. How many milligrams should they receive? So again, now this is telling you to the hundredths place, so make sure you're paying attention. So again, just in my calculator, 40 divided by 2.2. It's not an even number, so I'm going to save my rounding to the very end. Times my 0.05 milligrams per kilogram. So times 0.05. And I'm going to get 0.909. It says round to the hundredths place. So when I do that, I'm going to get 0.91 milligrams. Sorry about that. Okay. So notice I'm not right. Like if you plug this in your calculator and it's like 90909090, the reason I stop here is because I'm going to look at the thousandths place to tell me what to do with the hundredths place. And when I was here, I stopped here because I'm looking at the hundredths place to tell me what to do with the tenths place. Okay. Doctor orders digoxin 10 micrograms per kilogram for a newborn weighing 8 pounds. How many micrograms should the newborn receive? So again, we're going to do the same thing. 8 divided by 2.2. This is pounds per kilogram times 10 micrograms per kilogram. So 8 divided by 2.2 times 10. I'm going to get 36.36 repeating. It doesn't say to round to the nearest tenth, but my assumption is we would go ahead and just round to the nearest tenth. So 36.4 micrograms. All right. And number 9, look at that. So make sure you're reading this. It's already in kilograms, so you don't need to do any converting here. They're ordered to receive a medication at 5 milligrams per kilogram. What is the individual dose in milligrams? So all I'm going to do is take my 24 kilograms times my 5 milligrams per kilogram, and that will give me 24 times 5, 120 milligrams. That one was pretty straightforward. All right, last but not least, doctor orders 250 milligrams intramuscular. So anytime you see intramuscular, just know that it's ml. Drug is available as 350 milligrams per milliliter. How many milliliters do you administer? So again, this is just doing order over available times your quantity. And then it says round to nearest hundredths, so we're going to have a small number. So 250 divided by 350. And I'm going to get 0.714. And I'll just write a couple more numbers, 2857. So again, what am I going to do? I'm going to, it says round to nearest hundredths. So this is the hundredths place. So I need to look at the thousandths place. It's 4. So 4 or fewer, we don't round it up. So then your answer would just be the 0.71 milliliters. So that's rounded to nearest hundredths. Okay. I hope you find this helpful. If you have any questions, you can email me. You can ask your questions in the comments. And for those of you that are getting tested on this, I hope this was helpful.